We have 5 titles of HIPAA, meaning the sections of HIPAA, Obamacare, which came into picture where millions of uninsured Americans came under this fold of insurance company. So that was a time where these mid-level providers, it's not always doctors, we have like nurse practitioners and other clinical stuff, they were all in the team to provide healthcare to the patients. The rule is patients should have access to clinical or health. Next is portable. The information needs to be transmitted transparently or has various methodology like transactions, HIPAA approved transactions, so that from one side to the other it needs to be transmitted in a protected manner. Next comes renewability. Say for example, the company where you are working, you are being offered this group health insurance. What if you leave the company? That company you are leaving it and you are going to join another company, or for a certain amount of time you remain unemployed. What happens? So till those 2 months or 3 months, some healthcare is needed for you. Who will give the coverage? OBRA, omnibus rule, we have something, continuity of coverage. So even after you leave that company, you should have coverage. Say for example, the husband passes away and the woman, so she needs her husband insurance. This is called like continuity of coverage. So that is coming under renewability. We have this COBRA, Consolidated Omnibus Rule, or this act where they are trying to give this coverage for these people once there is a condition where that has been stopped.